Hey everyone, welcome to this explainer. Breathing is literally one of those invisible, automatic miracles of the human body. We take thousands of breaths a day without even thinking about it. But if you've ever had the terrifying experience of struggling to breathe, or watched someone you love gasp for air, you know exactly how fragile that process really is. Today, we're unpacking a medical device that can honestly turn that panic right back into peace. Yep, we're talking about the nebulizer. Think back to a time when a severe cold, an asthma attack, or maybe a sudden bout of bronchitis made your chest feel super tight. It's an incredibly helpless feeling, right? And in those stressful moments, trying to properly use a standard inhaler can be a real struggle, especially if you're dealing with a panicked kid or an elderly patient. Well, that is exactly where the nebulizer steps in as this vital, comforting, and just highly effective tool. Okay, let's dive right into our roadmap for today. We'll be covering what a nebulizer is, exactly when to use it, the different types of medications you can put in it, decoding that tricky dose puzzle, and finally, how to master maintaining your machine.
All right, Section 1, what is a nebulizer?
So simply put, a nebulizer is basically a mist-making delivery vehicle. It takes a prescribed liquid medication and uses compressed air, or in some of the newer mesh models, these tiny, high-frequency vibrations, to vaporize that liquid into an incredibly fine, breathable mist. You can kind of think of it like an express train. Instead of swallowing a pill and waiting for it to digest and finally get into your bloodstream, this mist bypasses all those blocked pathways and travels directly into your lungs right where you need it instantly. And this beautifully illustrates how that works. See, if a mist particle is too large, say over 10 microns, it literally just gets stuck in your nose or mouth. Particles between 5 and 10 microns might make it into the upper airways. But the true, absolute magic of the nebulizer is its ability to create these tiny particles between 1 and 5 microns. These droplets are microscopic, meaning they are small enough to travel deep into the very bottom layers of your lungs, giving you rapid, localized relief right at the exact site of the inflammation. Okay, Section 2, when to use it. Let's look at some specific conditions. Now, a nebulizer isn't just a one-trick pony. It's an incredibly versatile tool. It's famously used for asthma to deliver bronchodilators during those severe attacks when a patient is just way too out of breath to coordinate an inhaler. It's also absolutely crucial for managing COPD by opening up the airways. But it doesn't stop there. We're talking acute bronchitis, pneumonia, and even severe colds and the flu just to relieve chest congestion. It is especially fantastic for infants, the elderly, or frankly anyone who just can't manage those deep, perfectly timed breaths you need for a handheld inhaler. The best part? You can use it lying down, sitting up, or even while your toddler is literally just resting on your lap. Moving on to Section 3, the medication arsenals. The variety of medications this thing can handle is pretty vast. First up, you have your short-acting rescue meds. These are the rapid relief drugs for acute, sudden attacks. Then you've got long-acting medications for daily control. Third are corticosteroids, which are super important for knocking down severe lung inflammation. But what's really mind-blowing is that nebulizers can actually deliver localized antibiotics directly into the lungs for severe infections, like with cystic fibrosis, as well as mucolytics, which actively work to thin out and dissolve thick mucus. Oh, and here is a massive, real game changer. Depending on what your doctor prescribes, you can actually mix multiple liquid medications together right in the cup, delivering this customized, simultaneous dose of relief all in one sitting. All right, Section 4, the dose puzzle. This is the whole inhaler versus nebulizer debate. 10 times. The nominal dose, which just means the amount of medication you actually pour into the nebulizer cup, is often more than 10 times higher than the dose you'd get in a standard pocket inhaler for the exact same drug. Now, at first glance, if you're a caregiver, you might panic a little. Seeing a dose that huge, your very first thought is naturally going to be, oh my gosh, I am about to completely overdose my child. Just look at the dramatic numerical contrast here. Take albuterol, right? It's a very common airway opener. One single puff of an inhaler has just 0.2 milligrams. But the standard dose poured into a nebulizer is 2.5 milligrams. That is over 10 times the amount. It's the exact same story for ipratropium, 0.04 milligrams in an inhaler compared to a whopping 0.5 milligrams in the nebulizer. So what's going on here? How can this possibly be safe? Why is there this massive difference just to get the exact same clinical result? Well, here is where we solve the puzzle. Pay attention to the bar for the small volume nebulizer. When you use one of these machines, a pretty massive chunk of the medication literally just gets left behind in the plastic cup and the tubing. On top of that, another huge portion is completely lost to the surrounding air every single time the patient exhales because the machine just keeps pumping out mist nonstop. So at the end of the day, only a tiny fraction of that original 2.5 milligrams actually makes it down into the respiratory tract. So, the absolutely crucial takeaway here is this: that much larger dose in the nebulizer cup, it is not an accidental overdose. It is perfectly calibrated science. Medical engineers know exactly how much medicine is going to be lost in the device itself and in the exhaled air. So, they intentionally bump up the starting liquid amount to overcompensate for that exact loss. This ensures that the final amount of mist that actually settles deep into your lungs is virtually identical to a perfectly timed puff from an inhaler. Honestly, you are completely safe following those higher dosing guidelines. Finally, Section 5, Maintenance Mastery. Because this device creates this really warm, moist environment, it can easily turn into a breeding ground for bacteria if you ignore it. And trust me, inhaling bacteria is literally the last thing you want to do. But the cleaning steps are super simple, though completely non-negotiable. After every single use, just pull the parts apart and wash the cup and mouthpiece with standard dish soap and hot water, then let them air dry completely. Don't try to wash the tubing, okay? Just attach it to the machine empty and run it for a minute to blow it dry. Also, you're going to want to disinfect the parts daily. Just soak them in a mix of 1 part white vinegar to 3 parts hot water for about 60 minutes. Rinse them, air dry them, and you are good to go. It's a simple routine, but it totally protects your lungs and makes your equipment last way longer. Wow, okay, we really covered a lot of ground today. From understanding that this machine is essentially a high-tech express train delivering tiny 1 to 5 micron droplets directly into the lower lungs, to going over the exact times to use it and the different types of medications it can handle. But most importantly, we demystified those really scary-looking doses, proving that the science has calculated exactly what your body needs. And honestly, just understanding that brings so much peace of mind to caregivers and patients alike. So when the coughing starts and the chest tightens, panic doesn't have to be your default response anymore. You now have the knowledge of exactly what's happening inside that little plastic cup and, more importantly, inside your lungs. So I'll leave you with this. How will understanding the deep science behind your breath change your approach to your family's respiratory health the next time cold and flu season hits? Keep learning, keep breathing easy, and I'll catch you in the next explainer.